You heard me say before the break that black women in the United States are 3 times more likely to die from pregnancy-related causes than white women, and black babies are twice as likely to die before their first birthday. Shocking, true statistics, and something the March of Dimes is hoping to change through a series of conversations and much more, both nationally and locally. The Maternity Desert report, released this past month, shines a light on the lack of available care in many counties in this country, where the health equity gap is very evident. 5 million women live in those counties, 150,000 babies born in those counties that have limited access to appropriate maternal health care. 10 million women live in those counties where there are higher poverty rates and lower incomes. To talk about what's being done on the local and national levels about this troubling disparity, Stacey Stewart, the president and CEO of the March of Dimes. Good morning, Ms. Stewart, and congratulations on the work that you're doing to bring this story to a national level for a conversation. Let's talk about this. What is the main takeaway in the report that lays bare the challenges ahead as regards the equity or lack thereof?
Well, Kimbrell, thanks for having me this morning, and we're really pleased to be here. I'm the head of the March of Dimes, and a lot of people know the March of Dimes is really leading the fight nationally for the health of all moms and babies. And when we look at the maternal and infant health crisis that we're facing in the U.S. and especially in Texas, you know, we have to really understand what are some of the underlying causes of why so many women die as a result of pregnancy and childbirth, and why so many babies don't make it to their first birthday, especially women and babies of color. And one of the issues that we looked at is this idea of, is there even access? Are women living even in areas where they're close to the kind of care that would be the high quality care that they need? And what we found in doing this report called Nowhere to Go, looking at this issue of maternity care deserts, is that we have a significant number, millions of women, in fact, who live in counties. About 54% of all counties are considered maternity care deserts or have very limited access to care. A maternity care desert for us means a county that has no hospital offers obstetric services, no OBGYN or certified nurse midwife, and no birthing center. 54% of all counties have either no access to that kind of care or have very limited access, including in many places in Texas. And it's very concerning, and obviously underscores one of the big challenges that women have when they're trying to have a healthy pregnancy and deliver a healthy baby and stay healthy themselves. You
started a series of conversations across the country to at least jumpstart the conversation, to at least increase awareness. What are you hoping to accomplish by those conversations? What's the goal in those?
Well, at the March Dimes, we do a lot of different things to address the maternal and infant health crisis. We invest a lot of money into research. We have a lot of innovative programs to try to reach many women, especially in hard-to-reach places. And we also are huge in terms of our advocacy at the federal level and the state level. Part of what we want to do in issuing this report, and what we've also done, is launch a whole effort, especially as we lead up to the November elections, called #BlanketChange. What we're asking everybody to do is to first understand these issues of why in this country in 2020, in the wealthiest country in the world, why are we considered the most dangerous developed nation in the world in which to give birth? And what is it that we can do about it? Well, the first thing we can all do about it is to demand that we have policies in place that would expand the kind of care that women need to keep them healthy, to keep their babies healthy. And it's not just one policy approach, which is why we call this campaign blanket change. We need a blanket, comprehensive approach to transforming women's health care in this country, to transforming the way that we care for moms and babies. And if you go to blanketchange.org or marchofdimes.org, you'll get a bunch of information on the entire agenda. But what we're hoping to do is to create a movement, especially, again, leading up to the November elections, to make sure that anyone is voting for, whether they're Republican or Democrat, we don't think this issue is a partisan issue, and this shouldn't be a political issue.
Right.
We all come from moms. We should all care about every mom being healthy and every baby being healthy. We think that is an important value in this country. We just need everybody to stand up and have their voices heard and make sure that whoever's going to Congress in Washington next year, or whoever's taking office at a state level or even a local level, that they're keeping in mind and keeping the health of moms and babies as a priority.
What would you mentioned Houston a couple of times, or in Texas. What's the most concerning thing about the Houston region, and how would you suggest people get involved in being advocates on behalf of this challenge?
Well, of all the states in the country, Texas is probably high on the list of states that we're most concerned about. About 70% of all the counties in Texas are considered a maternity care desert or have very limited access. Right in Houston, there obviously are a lot of hospitals that offer obstetric care, a lot of physicians. But when you go out into the rural areas, like in Waller County, for example, you start to find counties, many counties along the border and in other places all across the state that have very, very limited access. We know that about 2/3 of all the maternity care deserts are in rural areas. About 1/3 are actually in urban areas all around the country. So this is an issue that really affects women of all backgrounds, white women, women of color. It does impact a lot of low and moderate income women, which is why we have to make sure that income and race and ethnicity, those should not be barriers to whether or not you're able to have a successful and healthy pregnancy and whether you're able to survive your childbirth simply because you lack the funds that many women may need or the care that they may need in order to make sure that they're healthy
and we're going to
before, during, and after pregnancy.
And we're going to continue this conversation. We got a lot more to talk about concerning the March of Dimes and the efforts that you're doing. I'm excited about this blanket change program, so much more you've talked about. We're going to talk about those things and what you can do to be involved in helping to be a part of changing this conversation so it's a positive conversation going forward. We got more coming up on Houston Newsmakers Extra. Go to Houston Newsmakers Extra on our clicktohouston.com Newsmakers page and get more of our conversation. Thank you again, Ms. Stewart.